Hi, this is Dr. Tom Rogers, the Common Sense Doctor of Performance Medicine, coming to you with a weekly podcast. Today, we're going to talk about something really exciting that I'm all pumped up about. I started thinking about cannabis many months ago when I read this book, and written by a well-known doctor who is very familiar and works with a lot of patients for medical marijuana. Now, we're going to just start calling it cannabis because marijuana has such a kind of a bad name, really. Although marijuana has been around for centuries. I mean, we're talking about many, many centuries, even back in Egyptian times. And when the Norsemen came to America, they actually brought it over here. But it's been around for centuries as a treatment for many medical ailments. As a matter of fact, General Lee and Grant used it in the Civil War for their soldiers. Benjamin Franklin used hemp. When I say hemp, that's kind of the umbrella name for two major things that we'll talk about tonight, and that is CBD and marijuana, or THC. So you can kind of equate marijuana with the THC part of this, and you can equate cannabidiol or CBD, which you can get anywhere now. It's kind of like the Wild Wild West with both of those products. So that's what we're going to kind of focus on. And the one reason I'm so excited about it is because I opened up a new office in Bristol. Now, I'm right on State Street, and I chose the Virginia side of State Street for one reason and one reason only. Why would I choose Virginia? Nobody's guessed this, but in Tennessee, the taxes are a lot lower. It's a great state. I'm not saying Virginia isn't, but Virginia has one thing going for it: medical marijuana, and actually even recreational marijuana is legal in Virginia, although the recreational part probably won't get here until 2024. But medical marijuana is already approved. So I'll be honest with you, I've never used marijuana in my life myself personally. I will tell you if I had. But there's many, many benefits to it that I've seen with patients. And I can tell you right now, if I'm 80 years old or 85 and I can't walk, I can't sleep, I'm hurting all the time, I'm anxious, heck yeah, I'm going to take medical marijuana. There'll be no question about it. So I think it's going to be a great tool for a lot of patients. It already is. It's been around, and it's estimated that between the ages of 30 and 50 right now in the United States, 50% of people use it anyway. So it's been real maligned, and the interesting story about marijuana is it was so well thought of for many, many centuries, up until really the early 19th century. And the story of it's really kind of interesting because it was used in all kinds of remedies and everything back in the day, potions, everything. It was a medicine. And then a curious thing happened. We had a lot of influx of Mexicans that came in, and it was they commonly used marijuana. A lot of them did. And at that time, some people thought of Mexicans as, kind of a lot of criminal activity, that type of thing, which is totally unjust. But so our government kind of came down really hard because of that. And then you had blacks that like to use marijuana, like Louis Armstrong. And some of our great musicians used it because it helped them be creative. And so it became like a racist issue, and it still is in a lot of ways. So that's how it kind of became demonized in the United States. So ever since 1930, when they criminalized it, it's still not federally approved for use. So it's illegal federally, but thank goodness states have power, and a state can decide whether to use it for medical purposes or even recreational purposes. I think to date there's like 34 states that have approved it for medical uses, and 17 also for recreational purposes. So So there's a lot of misunderstanding about cannabis in general. So when we're going to talk about two things. One is CBD, which you can get anywhere. You can get it at your local gas station. The problem with that is it's kind of like the Wild West. It's unregulated, and you can get you don't know what you're really getting unless you get it from a very reputable place. One of the brands that we happen to carry of CBD in our practice is called Charlotte's Web. And that's an interesting story, too, because there was a little girl years ago she was a 3-year-old girl. She had something called Dravet syndrome, which is continuous seizures, epileptic type seizures. I mean, she had them every hour. She saw all the neurologists, all the specialists. Nothing worked. And her dad moved to Colorado, consorted with some pharmacists, and they came up with a substance called CBD oil that virtually cured her seizures. I mean, she was about to die, and they cured her using CBD oil. I mean, I think she was having a seizure per hour until she got this, and then she had maybe 4 or 5 a month. So it literally saved her life. And now they call it Charlotte's Web after this girl named Charlotte Figge. So that's how it became well known. But it's interesting that they made that into a pharmaceutical, and the pharmaceutical name of that drug is Epidiolex, and it's a prescription medicine. The problem with it, though, is that it costs $34,000 a year to take that drug. It's just interesting how the pharmaceutical stuff works in our country. But anyway, so, when you look at it, both CBD and THC have their proper uses. CBD has to be legal, which it's legal in all 50 states, has to have less than 0.3% of THC. Remember, THC or marijuana is a psychoactive drug. It causes you to get high and different things. Cannabidiol or CBD does not have those psychoactive properties. So there's two different things here, but they both have their uses, and it's very in depth. As a matter of fact, in addition to reading this book, I just got back from a conference in South Florida on cannabis, so I learned a whole lot about it, and I'm anxious to kind of research it further, and I'll be able to use it in Virginia for sure. And I hope it helps a lot of people out. But anyway, there's many uses for both CBD and THC. It seems that the best combination is probably going to be a higher dose CBD and a very low dose THC, because they kind of work together. That's what you get when you get the whole plant, really. But anyway, it seems like they both have their own uses. And it's unusual because they both work for anxiety and pain. CBD works at low doses and high doses for anxiety. THC or marijuana works good at low doses for anxiety and pain, but at high doses it can make it worse. So you really have to know what you're doing. That's why I think it's going to be good for it to be legalized for medical purposes, so that a doctor who's very familiar with the use of these medicines or drugs can help you with whether or not you need to use this and what side effects you're going to have and all that. So, I'm totally against young kids using marijuana. I think a young person's brain is not really fully developed until they're about 25 years old. That prefrontal cortex, which implies judgment, a lot of cognitive functions, executive type functioning, is really not developed. And to me, in that age group, in the younger adolescents and kids, it's really, to me, the great demotivator. That's what I've always called it, because if you start smoking marijuana as a teenager, you're likely to get a little bit dull, and you won't be as productive as you can. Now, I won't say that every time, but in a lot of cases, that's what I've seen personally. So there's a lot of different types. There's actually over 100 different types of cannabinoids. And in the 1990s, an Israeli PhD discovered what we have in our own bodies called the endocannabinoid system. And that's a really interesting receptor system in our bodies. And it's all in our bodies. We have CB1 receptors, which are mainly in the brain. We have CB2 receptors, which is the rest of your body. But these things are just all over your body. And what they do, they're kind of cell signalers, which means that they really regulate a lot of different functions in your body. They help the body to maintain homeostasis, which is another word for balance in the body, and that's a good thing. CBD comes in three forms. Now remember, CBD is a form that has very little THC in it, or the psychoactive part. You have your isolated form, which has no THC in it whatsoever. And that's the form that you want to take if you're worried about, you work for the federal government or you're going to get drug tested a lot. That absolutely has no THC in it. The broad spectrum has all components except THC in it. Okay, so there's a lot of different components of this flower, or bud like they call it. Now, full spectrum, which seems to be the one that works the best, it really contains all the cannabis plants, including a small amount of THC. Remember, to be legal, it has to have less than 0.3 percentage. And when you talk about THC, there's so many different strains of it. They call them these wild names. And the sativa part of the strains, usually you think of that as more of the kind of cognitive enhancer, mood elevator. The Indicus brand is more like the relaxant, mellowing, maybe help you with sleep type form of THC. So there's a lot of different uses for this thing, but in general, the cannabis plant itself, now we're talking both CBD and THC, and a lot of times I think it's definitely better if you have it in a 1-to-1 ratio. You get too much THC and you're just looking for the high. You really want this to work for medical purposes, and it seems like it works best when it's in about a 1-to-1 ratio. As a matter of fact, there is a drug, it's a group of drugs called nabiximols, and those are sprays, and they come into 1-to-1 ratio. They're not legal in the United States for some reason, but they're really helpful in a lot of patients over in most every other country, including Canada, all the London, England, all the European countries, and South Africa, Australia, I think, and a lot of South America. But in any event, it's worked wonders for spasticity in MS patients particularly, but it has a lot of other things without giving you too much of a high. So I think hopefully they'll legalize that. I think all this is pushing towards eventual legalization of marijuana. I'm sure it will be legal in Tennessee at some point. That's why I'm anxious to be able to do some of it in Virginia, so I can eventually do it here when it becomes fully legal, because I don't want to do anything illegal, believe me. But cannabis in general has a lot of good properties. It's a great anti-inflammatory. That's why it's so good for pain relief. It's an antispasmodic. It's an anti-proliferative. Think about cancer as being proliferative. It's well known that it works for nausea and vomiting that you may get from chemotherapy. But what a lot of people don't know is the anti-proliferative properties actually retard the growth of tumors. And a lot of people think it may help tumors. It certainly will help chemotherapy work better, not just for taking care of the nausea and vomiting, but actually it decreases the proliferation of cancer. In my conference in Florida, there were many experts in their field from all over the prestigious universities, and one of the oncologists really thinks it has a lot of power with cancer. But anyway, it was interesting to listen to all these experts from all over the country talk about it. It's neuroprotective. There's a lot of indications that it may help ALS patients and patients with even Alzheimer's disease, as well as MS and Parkinson's as well. So it's a good analgesic. It's great for insomnia. There's no doubt about that. As we've talked about before, it's a great anti-epileptic drug. It's great for anxiety. It's probably really good for autism and ADHD. Now you have to balance it with use in younger people. So you lean more towards the CBD for that than the THC, of course. It's great for your immune system. It's great for fibromyalgia. We had a well-known doctor talk about her own lifelong battle with fibromyalgia, and it was really the only thing that helped her. It also helps with PMS and endometriosis. A lot of GYN doctors have talked about it, how it's very useful for that. And it helps a lot for weight loss because it increases your brown fat, which burns off the other visceral fat. And it kind of increases your dopamine reward system, your pleasure. So you don't eat for pleasure if you take a little bit of enhancement drug with probably a combination of both the CBD and the THC in low doses. Like I said before, the best ratio is probably going to be a 1-to-1, but there's many different forms of this. Now, how do you ingest this? This is a crazy story because I've had so many people tell me that they went to Colorado or California or some of these places. As a matter of fact, interesting story, in the state of Washington and Oregon, states where you think there's a lot of Starbucks, which there are, that's where it started. There's more marijuana dispensaries in those two states than all the Starbucks in those states. That's how big it is. But anyway, so what do? Do you put it under your tongue? Do you smoke it? Do you inhale it? Do you use an edible? I've had so many people tell me that they tried edibles and they didn't work until about 3 hours later, and they just zonked them. So the edibles are probably the least wanted form to take these things in, because what happens is you'll maybe eat a quarter of the brownie, like they say, to start out slow, and you feel nothing. You wait an hour or so, you feel nothing, so you eat a half, and then you eat the whole thing. 3 hours later, you're knocked on your butt. So the edibles are probably the worst form to take. The next worst form, which is better than edibles, is probably sublingual. And that's where a lot of people take the CBD. Of course, with CBD, you don't have to worry about that psychoactive effect. But probably the best way to take THC is probably going to be vaping it. Unfortunately, you don't want to vape the oils. You probably want to vape the whole plant, because you can get those oils adulterated with a lot of flavors and things like that. A few years ago, all these kids that were vaping in the high schools were killing over and dying from just vaping. Now, they probably weren't vaping marijuana. They may have been, who knows. But in any event, it was deduced that they had added vitamin E oils to these vape pens, and that was what was gumming up their lungs, and it actually killed a lot of teenagers. So that was a really bad thing. So the jury's out on this. Like I say, it's kind of like the wild west right now with both these compounds. But the more we research it, and more that it's turned over to qualified medical personnel, I think the better it's going to be, because I think there's going to be so many uses for medical cannabis that you can't believe it. But so your endocannabinoid system. This system was discovered in the 1990s, like I said, but it kind of modulates everything like pain, mood, appetite, stress, sleep, your metabolism, your immune function, even reproductive functions in male and female. Our body produces its own endocannabinoids. I mean, you make your own cannabis in your body. You produce your own. The most important one that you produce is called anandamide. They talked a lot about this in my Florida conference. So by ingesting the plant compounds, whether it be CBD or THC, you're enhancing your body's own anandamides. So all of your receptors in your body, your CB1s in your brain and the CB2s in the rest of your body react to this. And if you do it well, then it's going to help you if you have certain conditions. Again, I'm not talking about the recreational use of these products. We're talking about the medical uses of them. There are synthetic drugs that we've prescribed for years that synthetic THC, the most famous one is Marinol, that we use for nausea and vomiting of chemotherapy. We use it for wasting syndrome with HIV patients. We use it in a lot of senior patients that have no appetite as an appetite enhancer. So there's a lot of uses for this thing. It's just really fascinating to me. The hemp, the marijuana, all the different forms, all the legalities of it. So stay tuned because, we're going to really double down on this and get to know it really, really well and prescribe it to the appropriate patients for medical uses. So do your own research. I'm sure a lot of you are more familiar than I am with the use of marijuana, certainly. But do your research. Hopefully it'll be legal in all the states at some point, and we'll certainly, by being in Bristol, Virginia, we'll get a jump on use of medical marijuana. Thanks. I'll see you next week.